For staying with us, I'm George Maringa. On sign language is Catherine Simaloy. Tonight we speak to the governor of Muranga County, County 021, that is the Honorable Dr. Irungu Kang'ata. Thank you for coming, Dr. and welcome to our studios.
Thank you so much, and I'm happy to be with you.
Okay, brilliant. It's been a busy day, I reckon, for you.
Yes, today we were in a place called Idanga in Gatanga to distribute hybrid certified maize plus fertilizer in a program that targets 57,000 farmers. Yes.
So you were ranked as, a ranking of 62% among the top 10 governors. First of all, how did that make you feel?
Well, whereas it might appear good, I think from where we sit, the issue is not about being number one or number last.
Okay.
It's about service delivery. At the end of the day, it is the people of Muranga who will make a determination as to whether we are doing a good job or not. And therefore, I believe each governor is doing his best for his people. And for me, it's not an issue of being number one. I feel there's a lot to be done. There is poverty in our region. And until the day we eliminate poverty in my county, that is the day I will be happy. And the journey is very, very long.
Yeah, I notice you have the shirt labeled Inua Mkulima. If you could talk to us about that program.
Yes, Muranga County government has various economic programs that are whose intention is to lift people out of poverty. And one of the flagship program is called Inua Mkulima.
Yes.
It has three facets. Number one, we target mango farmers who are largely inhabitants of the lower region of Muranga. We entered into MOU with 3 private companies who uptake our mangoes. Before the program, our mango farmers used to earn about 2 bob per kg of mangoes, but after the arrangement, they now earn 16 bob per kg. Then you add a subsidy of 7 bob, so each earn about 23 shillings per kg. Secondly, the people in the upper region, to incentivize them to enter into cooperatives, we used to send them a subsidy of 3.5 shillings per kg of milk taken to a cooperative. But now we changed the model. We now have given them an e-voucher, a card. They go to a shop, they redeem various goods, including foodstuff like flour, and also farm inputs like artificial insemination, milk in jelly, feeds, and that way you uplift farmers. But also today we have commenced the program of distribution of fertilizer, which is 16 kg per farmer for free, plus hybrid certified seeds for the maize farmers, which we bought from Kenya Agricultural and Livestock Research Organization, CALO, and also Simlo Seed. The idea is to boost food productivity in Muranga County. Okay.
The revenue, raising measures that, you have implemented have enabled you to achieve up to 100% of own-source revenue. When you came in, what were the rankings at the time, or what were the percentage that the county would be able to gain at the time?
When we came in, we found Muranga County was getting, or rather raking in 500 million per annum as own source revenue.
Okay.
But as at now, June 2024,
yes,
we collected 1.1 billion Kenya shillings.
1.1 billion.
Yeah, that's almost doubling within that period we have been in office.
Did you, what are the incentives you did? Did you expand the tax base?
We did not increase our tax. In fact, the last financial bill that has been passed by County Assembly was in 2018.
Okay.
What we did was to do 2 things. One, to automate. Muranga has about 32 revenue streams: parking, markets, cess, hospitals, lands, all that. People pay through automated means. That has boosted compliance rate and efficiency. Number 2, we now went to do something we call to incentivize our employees, to take them to seminars, giving them presents, and also converting the employment from casual to contractual.
Okay.
And probably that also helped. And number 3 also, probably people see a correlation between what they are paying and the services they are receiving. Yes.
Do you think the conversation, there has been a discussion that we need to review the constitution in terms of the allocation that goes to counties? Is the 15% minimum the threshold, in your opinion, should it go higher or should it be at the prerogative of the executive?
It would definitely ought to go higher for several reasons. One is the rate of inflation.
Okay.
You see, a shilling that was 1 shilling in 2015 is not 1 shilling in 2024. A shilling loses value. So you ought to be increasing allocation of money to the counties to beat inflation. Secondly, there has been several laws that have been passed by the National Assembly which have impacted our payroll. And payrolls tends to be the largest components of our county budget. So, for instance, the National Assembly introduced a housing levy. They're also proposing to increase contribution to social health authority. All that then means our wage bill has been expanding, and therefore we need funds to cover that.
Okay.
Plus also, whatever we do to support the people at the local level, the demands keep on increasing. And that then means we need to ensure the resources coming from Nairobi, they need to expand simultaneously.
Do you think what would be the stalled cogs of the wheel in terms of trying to persuade the executive that indeed, whereas it is at 15%, this amount can go higher?
Yes, that's a constant conversation between the Council of Governors.
Yeah.
And I believe that there'll be a conversation as we elect new leaders into CUG on 7th of October.
Okay.
Yes.
Will you be fronting yourself for any seat in the CUG?
Yes, I have lodged my documents to seek to be the vice chairman of CUG. But this is more of service delivery. It's not something that ought to be contentious. And therefore, I leave it to my colleagues to see whether I can deliver that position. If I can't, it's okay. I think each governor who is currently serving is as competent as any other governor.
The people who have argued, the COG is a body that exists, in its entirety, yes, but, it has been argued in terms of its efficacy and advocacy in trying to, push for service delivery in the counties. What exactly, would be your defense in the establishment of this COG?
I think COG has done a good job so far in terms of pushing for devolution, but more can be done, particularly in embedding into a law. I think time has come for us to have a COG Act, which will definitely define and expand the role of COG. Yes.
Okay, and when you go for the vice chair position, what would be your key, itemization that you'd want to advocate for?
Remember, vice is a deputy of the chair. So I think best case scenario is to be subservient to whoever becomes the chair. And I don't think it is fair to appear as if you have your own agenda per se that departs to the vision of whoever becomes the chair.
The chair.
So I would propose we leave it at that as we wait to see whoever becomes the chair, what will be his or her core vision for the CUG.
Okay.
Yes.
The telemedicine in your county is also a program that seems to be working. If you could, break it in a nutshell, rather break it into pieces, what exactly that does for the people of Murang'a?
We do have patients who have chronic non-communicable diseases like mental illness, hypertension, diabetes. They usually come for clinics at Murang'a level 5 or Maragua. But knowing Murang'a how expansive it is, a person coming from villages near the forest, coming to Murang'a and going back, that might cost about 1,000 Kenya shilling travel costs, plus lunch. So you find a patient expending about 1,500 to reach Murang'a. So therefore, we came up with the idea of the doctor in Murang'a. He can be able to use technology and see a patient up near the Aberdares forest, or even our border with Machakos. And this was enabled to the fact that we have automated our county services almost 100%. We have put internet, which is stable. We have put computers. We have put local area network. Also solarization of some specific facilities, meaning the power can be a little bit stable. And therefore, we decided to try this method. Don't travel far. Sorry. Don't travel far. Go to your nearest dispensary. Talk to a doctor who is in Murang'a. And then you get your medicine. And that's it. You go back to your work. We think that will give patients better health outcomes. But of course, there are challenges. One, internet connectivity. There are instances we do experience downtime. Secondly, patients are paying because we told them, surely, you need to support us on this. We may not be able to offer free service. And therefore, there are instances where patients feel a little bit some pushback, or they feel the service is a little bit expensive, except those who have the county medical care card, which is called Kang'ata care. They are paying consultation 100, but they are getting free medicine. So there has been positive, but of course some challenges here and there.
Yes. This Kang'ata care, what does it entail?
Murang'a County Government entered into a memorandum of understanding with NHIF, where NHIF provides a medical cover for free to 40,000 households which are poor. We pay NHIF some money, in fact about 320 million per annum, and then they provide free services to 40,000 households. That might translate to about 160,000 individuals. When those individuals go to hospitals, they get free inpatient and outpatient services, dental and optical care, and last expense insurance cover. Meaning, if you are a person under that scheme, you pass on, or your dependent passes on, you are entitled to 100,000 Kenya shilling for free. That defrays your, let's say you left some children in school, they can use that money to pay for fees. But of course now, we are shifting to something we call SHIF.
Yes.
So we are still negotiating with the SHA, now it's called Social Health Authority, to see how we shall transit our people to SHA. We wrote a letter just the other day to ask them to transit our people to SHA. So we are having some discussion. We hope the transition will be seamless. Yes.
How effective, in terms of comparison, do you think that, or the lessons perhaps even SHA and the national government can pick from your program?
I am a little bit reluctant to say that Murang'a Kang'ata Care is a SI unit for good service delivery. I know national government has its own vision on what it can do to improve the people's health outcome. Be that as it may, our programs remain fairly popular amongst the people. I've gone to the villages, I've seen people saying they have been paid bills worth 800,000 Kenya shillings, 400,000 Kenya shillings. So I think the impact has been positive. Many poor families in Murang'a would have sold their pieces of land were it not for that important intervention.
Intervention, yeah.
And therefore, for us, it remains quite, I think, one of our most important intervention. Even those people who don't have that card, we always tell them it's positive for you because you'll be called to do harambes for your kin's people. Yeah. Of course, when one person is sick in a village, you find almost 100 persons to contribute to support that person. Meaning, once the county government supports that person, the 100 persons get a saving. So, and by the way, part of that money comes back to the county. How? These people, they get something called capitation, meaning they choose a facility where they go for outpatient facilities, and NHIF sends that money to the county as capitation. Also, if they go for inpatient services and they choose Muranga hospitals, we claim that money back. So in a way, you find we might pay 320 million, probably 200 million comes back to the county. Yes.
Okay. And what's the population you'd like to target to enroll perhaps by the end of this year?
Okay, Muranga has about 1 million residents. About, according to NHIF data, about 20 or 30% of them, they have their own medical insurance cover.
Okay.
But the best case scenario is to reach 100% coverage. So when you put in our county medical insurance scheme, maybe we may be about 40% or 45%. So we have 55% of Muranga people who do not have any cover. If we were to get more money, we can onboard more people into this scheme.
Okay.
But that is dependent on the kind of money we will get from whatever source.
Okay. Staying with that, our SMS line is open as well as our WhatsApp number. We'll also give you a chance to call in and ask the governor the questions. Still on Kang'ata Care, my name is Lynette Mburu. I'm married at Muranga County, Mathioya. I come from Kiambu County. Am I eligible for Kang'ata Care?
Yes, if you reside there, you can come, but of course through your husband. But for you to join Kang'ata Care, you do not apply.
Okay.
You don't do a letter, no.
So what happens?
We usually announce and say, on a certain date, on a certain venue, anyone who is interested to get this card, come. These are the criteria. Mainly, if you have certain diseases, let's say like diabetes or such, you come, bring documents, then we shall vet you. The first year, 20,000 people came and applied. We covered all of them, the households. Second year, 43,000 persons came seeking to get the card. Our budget was 30,000. But we decided, okay, let's onboard everyone because it's the right thing to do. However, when we took the 43,000 names to NHIF, about 5,000 were deemed as people already enrolled into NHIF through other schemes. Therefore, one couldn't get 2 cards. So 5,000 names were cancelled. So that 8,000 are the ones who are currently into the system. Now, when you add their dependents, their spouses, their children, that number now comes to about, let's say, 150, 40 or thereabout. Yes.
Do other counties come to benchmark and see what you're doing? Because all this sounds, like a good success story, especially on matters of healthcare.
Lamu County had such kind of a scheme.
Okay.
Where Kiambu came to Muranga, and we are happy. I think they have such kind of a cover currently. I think it covers about, yes. We also have, to the best of my knowledge, those are the 2 other counties that I'm aware of this scheme. Mombasa had said they're interested in doing it. So we are still, but I can only vouch for Kiambu and what we call Lamu. Also some other programs. I know other counties Even us, by the way, we learn from other counties. Let me
Okay.
just say that. A good example is we have a program called Smart City Program,
Yeah.
where we put tarmac in specific targeted urban towns. That idea, we took it from Kakamega during the reign of Governor Oparanya. Yeah, we have done, I think, now about 15 markets or towns in Murang'a. Also, we do refurbish ECDs. That idea, we took it from Kwale County during the reign of Governor Salim Vure. Yeah, where we put terrazzo, we put a ceiling. Yeah. We do have a school feeding program where we give every day fortified porridge to our 42,000 ECD learners. We are happy Nairobi took that idea. In fact, it upscaled it, which is progress. Of course, parents pay in Nairobi, but they pay minimally. Murang'a, they don't pay. But we might also consider upscaling it to the primary school. We are currently doing a pilot in 55 primary schools to see whether it's sustainable, so that we upscale to primary school. So I think there is no end to a good thing. A musician said that. So you have to look for best ideas from wherever, and people can also come and see what they can pick from Murang'a.
What's the secret that you employ in terms of your administration and service delivery that could be different in terms of, even we've seen the numbers you've talked about, you automated revenue raising from 500 million to 1.1 billion. What are some of the attributes that perhaps you could say, do you find it easier to work with other leaders? How is the environment like in Murang'a?
I think that question is best answered by other people, not me. And the reason is, there's a Kikuyu saying that he who talks about himself must talk good. Yeah, so that be best answered by that parties. But be that as it may, we believe we are not the brightest. We believe in collegiate exercise of power. You consult the assembly. The Assembly of Murang'a is a very important institution. Yeah, it has very bright young people. Yeah, you sit down and discuss and do what is good for Murang'a people. We also have very important executive members like the CECs, like chief officers, directors, county employees. So you sit down and talk. Yeah.
Apart from Smart City, there is also the Matters Education, and there is Uji in schools, Agatha as well.
Yes.
How is that program running along, especially for the ECDs?
Now, this is an idea that I noticed when I was a member of parliament of Keharu.
Yes.
And later when I became a senator. There is an NGO called Food for Education that gives food in Dagoretti. It's headed by a lady called Wawera. So I could see what my colleagues were doing in Dagoretti, later on Kiambu town constituency. So immediately I became a governor, I looked for Wawera. I told her, I'm very interested to bring this program in Murang'a. However, it was the first time they were coming in a rural setting. So it was a learning experience on their part. Remember, Kiambu town, or let's say Dagoretti, it's a small constituency of about, let's say, about how many schools? I think about 20 or 15 or so. But Murang'a, you are talking of 700 ECD schools dispersed in rural setting. 42,000 ECD learners who need to take porridge on a daily basis. So it was a humongous exercise to achieve that. And the model is about transporting. You build kitchens, then you transport. That brings huge logistical effort. And therefore, and also acceptability. People, we had to do a lot of public education to convince people this is good Uji. We even had to innovate and tell parents, can you elect one Uji champion to be looking at this, the hygiene angles of this endeavor. But I can tell you it later on became one of our important programs. The numbers of ECD learners skyrocketed. Now we have more children going to school because of that program. And we thank God it has been an important intervention. Parents used to pay about 20 shillings per cup in some schools to get that porridge. Now they don't pay anything. And we think poor parents now can proudly take their children to school.
Yeah. What is the acceptance rate? You've talked about acceptance. The enrollment rather in schools. Do you think it has increased, or do you have the figures?
Yes, it has increased. I think we came in at about 30,000 ECD learners. Now they range between 37,000 to 42,000, which for us we think it's positive.
In all these, where are the programs for the youth, or what focus areas that you're looking at to empower the young generation in your county?
Young people' main concern is about employment. Yes. Kenya has a huge level of unemployment amongst young people. We may not practically employ these young people into Murang'a County government. Remember, our payroll consumes 46% of our budget. In fact, when you now go to the real budget, it skyrockets to about 53%, which is against the law, because the law talks of a cap of 35%. We are being pushed by Senate and the control budget, or even our auditors, to fire people. But we can't agree. That's immoral. So we decided now what we do. That's why we came up with a program called Murang'a Youth Service. It has regulation and a policy that underpins it, that was passed by the assembly. The rationale of it is, or how it works, we tell young people, if you don't have employment, come before a chief's camp. We give you a ballot, written yes and no. If you pick yes, you join the program. We pick about 30 youths per ward, per cohort. They go and clean our towns. We pay them 400 shillings per day. 100 shillings go to the parent. Then after 2 months of cleaning and community work, they now transit to polytechnics of the county. They choose a trade, let's say painting, tiling, whatever trade you want, beauty. After 2 months, you now join, we pay for you an examination coordinator, grade 3 test. Once you pass, we give you 15,000 to go and open your business, and we also give you a tax waiver for 1 year. So you don't pay county for 1 year. Yes.
What business, would you be aiming to open with, 15,000?
Okay, some people you can use that money to buy for tools. Yeah, you can even open a kinyozi, you can buy whatever. We are talking of people in a rural setting.
Yeah.
You can also use it as a collateral and seek more money from banking institutions. The choice is yours.
Okay.
Yes.
And when you look at, the future of Murang'a County, where would you what's your vision board if you look at between now and between your first term as governor? What would be your vision board in terms of the highlights that you'd like to see apart from, Kang'ata Care and others?
Okay, first is to pray these programs, they grow big and bigger, and they impact more and more families. Remember what I said in the beginning, that the journey to transform Murang'a is long. And I'm not so sure we can achieve that within whatever period that we will serve. Others will come and do better job when we are long gone. Be that as it may, there are some programs that we would want to achieve. There are two. One is to upscale the school feeding programs from ECDs to the primary schools. And we are currently doing a pilot. But when you do our maths, it shows we need 200 million per annum to achieve that. But if we achieve that, so many positive things would accrue to the people of Murang'a. Number one, creation of jobs. That ecosystem would employ an extra 4,000 or 3,000 young people. Plus farmers. Remember, that program would require suppliers of tomatoes, onions, and other perishables. And also non-perishables like rice. So there would be huge spillovers that would help Murang'a people. That's one. Number two is in the area of agriculture. We are currently giving out certified seed and fertilizer. We pray we have good rains and we have good harvest. But the question will remain, where do we take that maize to? We are engaging private players to uptake our maize. And God willing, we want to give a guaranteed price of 3,500 per bag. If we achieve that, then the rural incomes will rise, because currently our maize farmers, they sell a bag about 2,000 Kenya shilling. So if you can give a guaranteed price of 3,500, then that will transform lives at the rural level. And we increase money circulation at that level. And that would be progress. Yeah, so for us, our vision is to link the industry with our farm inputs.
Okay.
Or no, outputs. You see, when you're a rural farmer, generally people farm for consumption. You plant maize, you eat. That's it. But I think that's not the best way forward. If we could now commercialize, you eat, but you have some excess which you can sell to the market, then definitely you are now transiting the people from subsistence to commercial farming. And that is how people move out of poverty. When people get money. Remember, United Nations defined poverty as people who earn $1.9 per day. That's about 247 Kenya shillings at the current exchange rate. You'll find probably that about 40% of our people in the rural areas. So if you can create an ecosystem where these people are earning more out of their endeavors per day, that would be the best way to fight rural poverty. And that's our vision.
Okay. We saw you give out and distributed bursaries over the weekend. There has been a conversation that some quarters argue that to resolve the funding issues, it would be best to collapse all these bursaries into one. What's your opinion about that?
First, I wouldn't mind, by the way, if indeed they were to do the correct calculations and promise Kenyans that if we do the collapsing, every Kenyan child will go to school for free from primary to the university. I can tell you I'll be the first person to surrender Murang'a's portion of bursary to such kind of a basket. But of course, we need evidence. It's very easy to calculate that. So let's wait for those who will give us that analysis. Be that as it may, before that time happens, Murang'a bursary scheme is divided into several interventions. The first targets young people transiting from primary to secondary. If you are automatically between number 1 to number 5, we give you 15,000 to transit. Why? One is to promote equity, because then every primary school benefits automatically from that intervention. There's no discrimination. Regional. Secondly, to promote meritocracy. Yeah, because everyone knows, okay, if I do put my best foot forward, I'll get this kind of money. The other thing The other intervention is a program called Nyota that we found there, but we decided to continue with it, that target poor people, and it supports them up to Form 4. We have been continuing with it. Thirdly is ward bursary. You know, members of the county assembly, they also need to feel part of the government. So we told them, you guys give us names at your ward level, we give you this allocation, we support. The other intervention is for orphans or students with disability. We give them, I think, about 10,000 in January, as long as you give evidence of being an orphan or a person with a disability who is in school. Yes.
Okay, brilliant. And, you know, just briefly, the conversation of overrepresentation in this country, what would be your opinion on that in terms of, even from a legal perspective, 14 years into this constitution? Are we overrepresented as a people?
There are two sides to that debate. Let me start with yes.
Okay.
One can argue, possibly yes, when you do a comparative analysis. I give an example of a country like India. India is about 1.4 billion residents. And 1.4 billion residents, I think their parliament is about 500 parliamentarians, compared to Kenya, which has about 340 something members of parliament, vis-a-vis a population of 15 million. Yeah. What about counties? Kenya has about 47 counties with 50 million residents. US has, I think, 50 or something, 50 states. But it has about 400 million residents. So one sees that imbalance. However, you must understand the political problems that
exist,
the drafter of the constitutions intended to cure. And therefore, if you collapse, let's say, for instance, counties, you might lead yourself into some problems that you may not see on the face value. And one of the reasons the draft of the constitution decided to have so many counties, it was to circumvent the problem of ethnic politics. If you are to collapse the counties into smaller, let's say, counties,
yes,
or rather to bigger counties. Let's say, for instance, you have 8 counties to coincide with the former provinces. There are risks which you might encounter. Number one is you create very strong devolved units that have the power to potentially secede. And they will have governors who are so powerful, who can easily torpedo the central government. And there are historical examples for that. One best example is in Nigeria, the first Republic of Nigeria between 1963 and I think 1966 or 67.
Okay.
When the country was divided into 3 regions of the northern, where we had the House of Fulani, the southwestern, where we had Yoruba, and the southeastern, where we had Igbo. And the Igbo decided to fight what we call the Biafran War. It was so devastating that once they were defeated, the constitution decided to split up those regions. The same with our colleagues here in Southern Sudan.
Okay.
Yeah. So the point is, at times, you must understand devolved units can become centers of political agitation that can be very devastating to a country. So I think Kenyans need to debate that. I can only comment as a lawyer.
Governor, as you end up, when are you going to see the mountain restful? It is quite restless for now.
God will give us a way forward.
Are you sure?
Of course, God is the Almighty. He knows the best case for us. Yes.
In terms of even the squabbles we are seeing, what would be the best way forward out of it?
I quote a German chancellor.
Yes.
1800s. He was called Bismarck, Ottoman. Bismarck. I think it was called Bismarck. he said, in times of political crisis and upheavals, a statesman should lie low, listening to the ground. And then he listens for the footsteps of God passing through historical events. Once he hears those footsteps of God, he rises and touches the hem of his cloth. He rises up. So the point is, we lie low, we wait to hear the sounding of the footsteps of God.
You played safe.
Sounding through history.
Sounding through history. You played safe there, Governor. Thank you so much for joining us. The Governor of Muranga County, County 021, Dr. Irongo Kang'ata, speaking to us right here on the Daily Report. I'm George Maringa. Our sign language interpreter has been Catherine Simaloy. We want to wish you a good night from Nairobi. I'll see you tomorrow.